All right, so I'm going to do some dry needling. So dry needling, I'll explain a little bit what that is first. So dry needling is where we stick a very tiny needle, a monofilament needle, into the muscle to get an effect. Now the effect can be to reduce pain, the effect can be to relax the muscle, or the effect can be to stimulate the muscle and make it work better. So there's a couple of different reasons why we use this. It is not acupuncture, because some people will ask that. The difference is that we're just going straight into a muscle to have an effect on the muscle. As physical therapists, we try to have an effect on muscles all the time. This is just a different tool that we're using. So we're going to grab one of these needles. Now first I'm going to clean her skin with alcohol, because we want a nice clean technique. And we can pretty much do this on any muscle in the body that we can have safe access to. This is a pretty easy one, the quadricep muscle. We're going to go on the VMO part of that muscle. So I'm going to grab the needle. And usually I will poke around a little bit and find a trigger point. And most of the time the patient will say, "Can you quit poking me and stick the needle in there already?" So the needle is already in. Now I'm going to drive it in here. Now sometimes I may get a little twitch response from the muscle. I didn't really this time. And then I will typically use some electrical stimulation on that. I just have a dispersive electrode here that just needs to be anywhere on her skin, and now her muscle will start contracting when I start turning up the stimulation. And the patient will experience this kind of as a weird sensation because their muscle is contracting without them telling it to contract. So now if the muscle is really tight, this will be relaxing, but it can also be stimulating if it's not working right. And I might put this on there for 30 seconds or so. Not necessarily painful, it may be a little uncomfortable, especially when you get a twitch response. And I can use a different frequency. This will, more for chronic problems, I will go with a little faster frequency. It'll feel a little bit more crampy. So I'm going to go up a little. There you can go. See her muscles kind of shaking, quivering. It's a really pretty, easy technique, usually very effective. Just pull the needle out. Once in a while, may get a little drop. Oh, we see a tiny, tiny little drop here, but it stops the moment we stop this. And we can pretty much do that in any muscle in the body again that we have access to. We can have a pattern where we do that on the lower back, and then connect that with the leg for people that have sciatica. We can do this for TMJ problems. We can do this for headaches. We can do this pretty much, like I said, anywhere in the body that we have muscles.
How did you? You have to get certified for this technique,
yes.
Right? What's the certification process?
It was actually a very intensive 3-day course that I did about 5 years ago. The dry needling is very new in the physical therapy world. I think before I did that certification, there was only one other therapist in town that was doing this. So now there's more therapists doing it because there's really more of a need for it. Patients starting to recognize this as a technique they want. When I first started doing it, I had to kind of push it on the patients. Let's just do this on you, it'll work. And now patients are actually asking for it. So very effective. A lot of times we get a very quick effect, or we get an effect on patients that otherwise aren't responding great. So it's not a substitution for other therapy things that we're doing. We're still going to have to strengthen that muscle. We still have to stretch out that muscle. We still have to do all the usual stuff that we do in physical therapy, but a lot of times it gets quicker results and better results.